Hey, it's a Joe on the radio. Good morning. 5 minutes after 8 o'clock. We got this. Everything's going to be okay. Everybody calm down. I know it's a little crazy. You watch all the negativity. And thanks for letting us have some fun this morning. We got a great show for you today. And I'm so honored to bring to the airwaves Dr. Steven Greer, practicing surgeon, pioneering how hospitals care for the elderly, right? He also became a Wall Street analyst. How about that? And portfolio manager 20 years ago. He's author of the book, The Medical Advocate. Dr. Greer is the first man that you heard on any media anywhere talk about drugs that could possibly offset the effects of the coronavirus. Talked about Remdesivir. Talked about this a couple weeks ago, hydroxychloroquine. And Dr. Greer is kind enough to join us this morning. Dr. Steven, thank you for being on the show. And so we're just very, very privileged to have you with us this morning, sir.
Hey, my pleasure. How are you doing?
Well, great, but man, you were way ahead of the curve. Dr. Greer, you said it a couple weeks ago. No one was talking about it. You talked about these drugs, but I'm telling you, man, that was great. And then all of a sudden, they didn't give you or me credit for bringing you to the airwaves, or Frank, our producer, you know.
Welcome to my world. I'm constantly giving people on Fox these kinds of tips, and they use it, and they never give you credit. I just get used to it by now.
Yes, sir.
Just to be a little, I'm not that great. I mean, people, you mentioned the Wall Street job. We're always looking ahead. These drugs were well known to anyone who could put a little bit of effort into it. And so it just, you know, and Wall Street, we're always looking ahead, trying to predict what's going to happen, because if you react after the news, you won't make any money. So I'm always looking forward, and that's how I saw these things.
Well, you were right on the money, sir. So tell us about Which drug is better? Is the hydroxychloroquine with the Z-Pack, Remdesivir? Which one do you think works better, doctor?
Okay, that's a good question. Now, they're all, the hydroxychloroquine is now an officially approved FDA drug to treat this coronavirus, so it's no longer controversial. But when you want to answer questions of which is better, that's going to take a big multi-center head-to-head trial. We won't know that for a long time. And you don't need to know it. You don't need to have randomized controlled trials for everything. And what we have is real-world, credible data collected by credible scientists showing prospectively that hydroxychloroquine and Z-Pack works. And so there's no reason. It would be unethical. It would be unethical to withhold that drug from use.
Thank you for saying that, because if there's an element of proof that it shows up in a positive way, you should use it. And do we have enough of the drug? Well, yes,
in
go ahead.
clinical trials, if you're testing A versus B and the option A is working so well, they will stop the trial because it's unethical to keep giving patients option B that doesn't work. So that's it's just basic clinical trial stuff. It's absolutely correct to use hydroxychloroquine. It's absolutely correct for the FDA to approve it. Sorry to interrupt you here.
No, I was going to say, is it available? Is it readily available? Because everybody's complaining we don't have ventilators, we don't have this, we don't have that. I want to see the drug, fast track to these states.
The hydroxychloroquine. That's interesting. I just saw a Wall Street report today where they're tracking the various generic drug makers. I think there's plenty of manufacturing supply, but in the hot spots of New York, I don't believe it's too easily available, but the hospitals can get it. So down here in Florida, where I am right now, it is available. So I think, I haven't done a lot of homework on this, but I think it's pretty much available throughout most of the country, unless you're in a big hotspot like Brooklyn or Queens.
Yeah, Dr. Greer, how important is it to manufacture the drugs right here in America?
Oh, yeah, we talked about this last time. I said this 10 years ago in an essay. It's just obvious. Yeah, you've got to be making this stuff here. Because I'll give you an example. Just yesterday, India, which makes, it's not just China. India makes a lot of our drugs, too. India is banning the exportation of hydroxychloroquine because they need it for themselves. Well, that's understandable, except that exposes us. So it's a matter. Fortunately, China hasn't done that yet. I think they know it'd lead to war or something. But they could easily just say, "Hey, we need the drug for ourselves." Same thing with medical devices. Everything comes from China, and it's crazy. Yeah.
Well, we heard Senator Tom Cotton over the weekend, and he sounded a lot like you in talking about China. And as it stands now, what do we know about China's role in this pandemic, Dr. Greer?
Well, yeah, I was going to say that is I just threw out there sort of half guessing based on intuition that this sure seemed like a weapons engineered virus, not some random mutation in the wild. And that's what the various senators are coming right out and saying that now. That China has a bioweapons program, which is illegal, violates all the rules of post World War II rules, and they're doing it. Why they're doing it, I'm not exactly sure why. But they screw up. They're sloppy. They're terrible at what they do, and they try to do sophisticated things, and then they let a virus leak out, which they shouldn't have been making in the first place. So,
you know what, Dr. Greer, you're right on the money. Thank God you're right. You are so on top of this. And just to be clear, and we had talked about this last time, but just to reiterate, if I may, the molecular structure of this virus, the way it attacks the lungs, is it man-made or did it? We talked about it last time, but just to reiterate, is it man-made or was it an accident that it came out the way it did?
Well, I can only go by, I sort of guessed and speculated and so forth, but now I believe the senators who sit on intelligence committees and so forth, and they've got more information than I do, and it looks to be genetically engineered, man-made as a bioweapon. Yeah.
See, I want everybody to hear that. Thank you for saying it because they say, oh, you're conspiratorial, Joe. Oh, my gosh, you think now you're being a conspiracist. No. It was just so coincidental. And also the timing of this whole thing. And again, Dr. Greer, you are so great, man. I got to tell you something. We appreciate it so much. But are the deaths being, and I say this with the ultimate respect for those lives lost, but are they over exaggerating on the deaths? Like, are they putting coronavirus when someone had a really severe underlying illness when somebody died just to be sensational anymore? Am I being? Is that too dramatic when I say that?
It's a definite political ploy to hype this. Just this week, intentionally, I don't even blame Anthony Fauci. I think the White House is on board. He came out with this outrageous number of there could be 200,000 deaths. And then the next morning, Brian Kilmeade on Fox and Friends said there will be 200,000. Well, I've had a conversation back and forth in writing. You could read it on my website. Dr. Anthony Fauci does not have any models to back that up. He's bluffing, guessing, and no one questions him, and they all take him as the unquestionable master. He's making that stuff up. So my estimations in my model, for whatever it's worth, are much less than that. Now, and then right now, look at the numbers that we have right now projected out. So let's say we get 30,000 deaths. That's right up there on par with the regular influenza. So the bad news is it is a really bad virus to certain people who seem to be susceptible to it, whereas others just do fine. So it is a weird, scary disease that we haven't seen before, but the net effect is that the total death rate is not something, in my opinion, that warrants this absolute political overreaction across the country. It's a domino effect. When Cuomo does it, everyone else does it. And it's unwarranted, and I think it's unconstitutional. There's no constitutional right to make people stay in their homes. It's violating our civil rights. You'll see in the Seattle police chief say that it's illegal and will arrest you if you say anything about the virus being related to China. And so our First Amendment, our Second Amendment, our civil rights are being destroyed by this crisis. There's people out there opportunizing on this crisis.
Yeah, I appreciate you saying Dr. Steven Greer, because when you think about somebody, my friend, Brian's a friend of Brian Kilmeade's a buddy of mine, and when we hear, and if it's Brian Kilmeade or it's Piscopo, you hear Dr. Fauci say this, you go, wow, 200,000, that's what's going to happen. So we say it, but it becomes a snowball effect. But you've been critical of Dr. Fauci. By the way, with great respect to Dr. Fauci, of course, but the two of you had that. You went back and forth with an email exchange with him personally this week.
But that's right. Yeah, I did. And he just confirmed what I suspected. And I know what variables are available. I know what data are available to drive a model. And I'm wondering, where's he coming up with his model? Because I don't have that. And sure enough, he doesn't. His reply was first he tried to point the finger at Dr. Birx and say she's the one who did it. And I replied, okay, well, just show me the model. And then he stopped replying to me. And So it's nonsense.
Oh, this is listen. It allays our fears a little bit, Dr. Greer, with what you're saying. And by the way, can we go from there to the ventilator shortage? I mean,
Sure, sure.
is that
The
manufactured
ventilator
as well?
Yeah. The ventilator shortage is a total distraction. It's not an issue. Ventilators are the last resort. They're not even curing people. The focus should be on medications to prevent people from because so as soon as you are tested positive and you have symptoms and you go to the hospital,
Yes, sir.
you should be getting one of these medications. Here's the point that I
Wow.
wrote, and I'm the only one to say this, is I have unfortunately experienced at some of these Brooklyns and Queens hospitals back 20 some years ago when I was doing clinical trials at NYU as a surgery resident. I would go out there, and they were scandalous hospitals that over the last 10, 15 years have been in so much trouble that Governor Cuomo considered shutting them down. And then, in his ultimate wisdom, decided to throw $7 billion at them. So these are not the best hospitals to be treating even routine medicine, okay? They're so bad they're almost shut down. So here's what needs to be happening. In a problem like this, there's a term called centers of excellence. Every single person testing positive should be sent, I suggest, to the Javits Center or some military-controlled place where you got qualified people who can do this, and centralize them and have a big, huge Javits Center treating all these people, giving them the blood transfusions of plasma from people who've already had it, giving them hydroxychloroquine, giving them remdesivir and the 3 other experimental drugs. Then you'll prevent the death. You'll take the burden off of these hospitals that can't even do routine medicine, that shouldn't be treating this. And that's what needs to happen. And I mean, I'm pounding the table on that, and I don't know why it's not happening. Hopefully, Trump and the military hears us.
Yeah, and indeed they do. I think they sample a lot of the morning shows, so we appreciate you getting the word out. Dr. Steven Greer, this man is one of the brightest gentlemen out there in dealing with this coronavirus, and also you're so experienced treating the elderly, Dr. Greer. We're seeing nursing homes being particularly hard hit by this epidemic. What can be done in nursing homes that's not being done now, sir?
Boy, that's funny you mentioned that. I didn't tell you to say that. There's already been $8 billion approved early on for emergency. So I've reached out to the White House. I've got a company with a very famous doctor who's already advising the White House. So we've got this credible team. We already have gadgets where you can do a remote pulse ox. To make a long story short, I think we could immediately start using telemedicine because doctors are afraid to go in their patients, family members, so they're being quarantined, these nursing homes, and even if they're not sick, they've been cut off from society. So we need to do telemedicine, iPads, screens where they can talk to doctors or even family members. That's step number one, and I have a proposal and to do that, and I'm waiting for them to get back with me. But so I think that a lot. See, if you are a wound care expert or any other type of doctor, you can advise the nurses and so forth what to do. You don't actually have to be there. So, that's my recommendation is to start piping in some telemedicine to these nursing homes.
Wow, 819, and we're going to let you go, Dr. Greer. We appreciate your valuable time and your brilliance, sir. But I just want to ask you about, you're a finance expert on top of being the great doctor that you are. Do you see the economy making any sort of comeback when this is all over?
Well, not at the current rate. If they keep thinking more about their political careers and unnecessarily shutting down states and industry, no, this is bad news. But if they, and I have a hunch Trump's going to wake up and change his tune. But so if it goes beyond April, I'm not too optimistic. But yeah, it's all up to the politicians.
And is it okay to wear a mask to go out? I'm a hype. Huh? No mask or to mask or not to mask?
Yes. I forgot. Thanks for reminding me. Is I've been telling everybody to wear a mask. And now this is not a conspiracy theory. It's absolutely true, and it's provable. Is they've been lying to us in a massive propaganda campaign, literally. And that's not. I'm not using those words lightly. To prevent a run on the stockpile for first, responders, nurses, doctors, and stuff. Well, that's an understandable reason, but you can never excuse mass propaganda. It's a slippery slope, and so they've been lying to us. mask, even it doesn't have to be a surgical mask. You can put a handkerchief in your mouth, which is what they're doing out in Los Angeles now. And it works for two reasons. It prevents you from touching your own face, and it does prevent particles and droplets if you cough, despite what people say. So absolutely wear a mask. And you have to go outside to get groceries and so forth. So people are leaving the house. And when you leave the house, put a handkerchief, a mask, anything around your face, and wear gloves at the same time. And those will do two very effective things that help prevent from spreading or contracting it.
Wow, Dr. Greer, this is the most vital 20 minutes we've done on the radio, and we're just so privileged to have you. The name of the book is The Medical Advocate from Dr. Greer, practicing surgeon that works with the elderly, does great work with the elderly, Wall Street analyst, portfolio manager. Dr. Greer, we're just so privileged to have you with us. Come back again. Keep us posted if you hear anything, because you're making an awful lot of sense. And where can we find you online, Dr. Greer, if I may?
You mean like social media? I boycott Twitter and all that stuff. But I recently just deleted my Instagram app because I was spending too much time on it with my golf videos. But but just go to the Healthcare Channel.
Yes.
The
Okay.
Healthcare Channel,
Okay.
or my little personal thing that's called GreerJournal.com. But
GreerJournal.com. Okay.
the Healthcare Channel is something I started back in '06. It was the first ever internet-based media platform where we interviewed experts like Dr. Fauci, and we sold it to Wall Street for a subscription. So I would recommend, for this topic, you can go to the Healthcare Channel.
Great. Thanks. Dr. Greer, thank you. The Medical Advocate is the name of the book as well. Dr. Steven Greer, thank you so much. Let's talk soon, sir. And really, really infinite thanks for your expertise, sir.
Yeah, my pleasure. Thanks a lot.
Dr. Steven Greer right there. Hey, James Rosen coming up on the Piscopo.